My question is to the Minister for Health. How is the Albanese Labor government ensuring Australians have access to affordable, life-changing medicines on the PBS? Why is the government making all medicines on the PBS cheaper after a decade of cuts and neglect?
Call to the Minister for Health and Aged Care.
Yeah, thank you, Speaker. And I thank the member for McEwen for his question and his support of strengthening Medicare and making medicines cheaper. He knows that Australia has one of the best medicine systems in the world, Mr Speaker, one underpinned by the PBS, one of Labor legacies that again was opposed tooth and nail by the Liberal Party at the time. And the PBS ensures that Australians have access to the world's best treatment at affordable prices. And since we were elected only 2 and a bit years ago, Mr Speaker, we've made more than 250 new and expanded listings on the PBS. This month, along with a number of other medicines, we listed a new medicine, Vazkepa, to reduce the risk of repeat heart attacks or strokes for patients with high triglycerides. Around 1 in 3 people, Mr Speaker, who survive a heart attack or a stroke will go on to have a repeat event within 7 years, and so often that repeat event will either be deadly or, at the very least, very seriously disabling. And this is the first treatment listed on the PBS for this group of patients. It will benefit more than 10,000 patients a year, Mr Speaker. We think it will save lives. It will genuinely save many, many lives, and it will be available at PBS prices, those affordable PBS prices, instead of patients paying almost $2,000 a year. And, Mr Speaker, we've been making those PBS prices even cheaper for all Australians. In our first 3 months, we slashed the maximum amount that pensioners would pay for medicines across a given year by 25%. And the final budget outcome that the Treasurer released last month, Mr Speaker, revealed that that measure alone delivered pensioners 22 million free scripts last year that would otherwise not have been delivered. 22 million free scripts, saving pensioners about $170 million just in one year. And last year, Mr Speaker, also we delivered general patients, not concessional patients, but general patients, the biggest cut to the price of medicines in the 75-year history of the PBS. These measures, along with 60-day scripts and all those additional listings on the PBS, have saved Australians hundreds and hundreds of millions of dollars, making a real difference to Australian households. But we know household budgets are still under real pressure, Mr Speaker, and that we have to do more, which is why in this year's budget we also announced that we would be freezing the price of PBS medicines next year for up to 5 years, saving patients another $500 million, Mr Speaker. But what we also know is that is all under threat from a shadow treasurer who has said very openly he doesn't support any of our additional investments in bulk billing, in urgent care clinics and in cheaper medicines, Mr Speaker. That is the clear choice for Australians: cheaper medicines, cost of living, or those opposite.